gëj dem lopitaan pour néemeeku sa wérgu yaram
ndax xam nga sa wérgu yaram fu mu tollu
est-ce que yaa ngi bàyyi xel ci li ngay lekka
wala exercise bokk na ci li ngay sóoraale ci sa dundu pour am ci lu la leer toppaleen ñu leen di bu ne ci suñ programme health check nga xam ne lépp lu ñuy waxtaanee dina méngoo ak sa wérgu yaram.
Good day everyone. My name is Dr.KEHINDE ODUNTAN. I am a specialist in general surgery, also specialist in family medicine, and so specialized in obesity surgery. I'm a consultant of general surgery here in MEDICARE clinic, also the head of the department of general surgery and the manager of the theater. I've been invited today to talk about sexual dysfunction in men, which I think is a very important topic for every man to have idea about. What do we know about sexual dysfunction in men? Sexual dysfunction in men are varied, but the most common one that we might talk about is the erectile dysfunction. This is when a man has inability to acquire a strong erection enough to make penetration during sexual acts. This is the most common one, but this could also be associated to other dysfunction such as preterm ejaculation, inability to ejaculate at all, or delayed ejaculation. Sometimes these problems come together, or sometimes they come isolated or separated in the individuals. So you will wonder, what are the causes? Why do people have sexual dysfunction? There are many causes for sexual dysfunction in men, and specifically erectile dysfunction. There are a lot of causes, but we will try to highlight some of the most important ones. It is important for us to understand that to have a good erection, the penis being an organ, just imagine it as a sponge that has a lot of holes inside, and this hole is connected to a blood vessel that blood has to rush into the penis and make it to erect. If there's any problem in this circulatory system of the penis that does not allow blood to flow enough into the penis, it's going to cause lack of erection. Because for the penis to be erected, the blood has to flow in large quantity and has to be sustained in time. Also, it is important for us to know that the brain is what controls the sexual act. If the brain is not sending enough signal to the penis or to the blood vessel to dilate and let blood flow into the penis, then the erection will not be attained. So if we already understand that this is a problem that is directly related to circulatory disorder and to brain disorder or psychological disorder, then we would already understand every other point that comes behind. Now, most common cause of erectile dysfunction in men is diabetes mellitus. And this diabetes mellitus is nothing other than problem in the control of sugar in the blood. Now, diabetes mellitus will cause a lot of damage to the blood vessel. It will cause also damage to the nervous system, and thereby reducing the stimulus for sexual arousal, reducing the flow of blood to the penis, and thereby reducing the erectile function. Also, high blood pressure is another very common cause for sexual dysfunction, especially erectile dysfunction. High blood pressure cause this problem the same way diabetes will cause it, because they cause damage to the blood vessel. When the blood vessels are not functioning, they also affect the nerves, and at the end of the day, the erectile function will be affected. Another probable cause to erectile function is obesity. People who are obese, obesity itself is a risk factor to have diabetes, and it's a risk factor to have high blood pressure. But on its own, there will be too much of fat flowing in the blood vessel that will cause obstruction. It will cause formation of plaque and thrombus in the blood vessel that will lead to obstruction. And this will be another cause for sexual dysfunction. Inside this topic, I think it is important for us to say high cholesterol level is a high risk for erectile dysfunction. Another thing we might need to talk about is habits. People who have habit of smoking and who have habit of drinking. These two things are also going to lead to cardiovascular disorder, and they will lead to damage in blood vessel definitely, like excessive contraction of the blood vessel and it's not relaxed enough to allow high flow of blood into the penis for erection, then this can lead to erectile dysfunction. Another thing we need to mention of that is very important is cardiovascular disorder. When people have heart diseases, when there's a heart disease, the heart cannot pump enough blood to the body, talk less of pumping it to the penis. So the flow of blood will be affected, and definitely these people will result in having erectile dysfunction. Hormonal disorder in the body. The testicle produces an hormone in the body, which is very important. This is testosterone. This testosterone is responsible for stimulating sexual arousal. So if testosterone level is low, the desire to have sex will be low. And if the desire to have sex is low, then the brain cannot send enough signal to the blood vessel and to the penis to get erection. So the erection is going to be weak or will be absent. Apart from that, testosterone improves cardiovascular function, thereby increasing the possibility of penile erection. If testosterone level is low, the penile erection will be defectuous. And then lastly, psychological disorder is important. When we say psychological disorder, we are talking about stress in people, lack of concentration. This could be preceded with lack of sleep, for example. And if you're not able to sleep very well, the brain cannot repair itself. The brain cannot focus. And if there's no focus in the sexual act, definitely this will lead to erectile dysfunction. It is also important in a relationship to understand that sometimes having to do the same routine every time becomes boring, and the desire or the enjoyment in sexual acts becomes less. And in this case, it can lead to a psychological lack of interest in having sex or having the same routine all the time. So what is important in this aspect is that couples who have this problem might need to visit a sex therapist or psychologist or couple therapy to improve the affection between them and reduce psychological disorder that can lead to erectile dysfunction. Also, maybe you might need to try different things sexually to increase the stimulus and to increase the joy of having sex. These are the most common factors that can lead to sexual disorder. Now, how do we know that someone has a sexual disorder? It is simply the manifestation of inability to get a good erection, or the inability of someone to maintain an erection for a long period, or the inability of someone to have a prolonged penetration without having an ejaculation. That means the ability of someone to have a long enough penetration before ejaculation. If someone has this problem and also have associated symptoms such as delayed ejaculation, such as premature ejaculation or preterm ejaculation, or inability to ejaculate at all, then this person needs to visit a doctor to do a good assessment, look for probable causes, and definitely to be able to do treatment that is corresponding to the cause of this erectile dysfunction. How do we treat sexual dysfunction? Definitely, the treatment will be dependent on the cause of this sexual dysfunction. Like we already mentioned, some diseases that can cause it, the lifestyle of the person that could lead to sexual dysfunction, hormonal disorder that could lead to sexual dysfunction. So we would have to first identify what is the cause, do some studies to identify the cause of sexual dysfunction. Then the treatment will be correspondent to the cause of sexual dysfunction. It's important not to take risk in taking medication without seeing a doctor, because some of this medication may have side effects and they can lead to worsening of other diseases such as heart disorder, among other things. Recommendation, or in conclusion, sexual disorder is a common problem in men. There are a lot of causes for sexual dysfunction that needs to be studied and diagnosed if we have a couple suffering from this, this disorder. And once this is identified, then treatment can be done accordingly to overcome the problem. Visit your doctor if you find any of this disorder. I would recommend you come to Medicare clinic. We have good specialists here. Myself, our gynecologist, that can also orientate their treatment both for men and women and help in the psychological area of sexual functioning, as well as in pathological causes of sexual dysfunction. Thank you very much for your time, for listening to the program, and I hope you all have benefited from this important topic and this very important topic we brought to you. If you have any doubts, you could contact Medicare Clinic Reception. The number is 248-2459. Call the reception, ask for Dr. KEHINDE O. I am the general surgeon here in Medicare Clinic, and we can always attend to your doubts and your worries. Thank you very much. Please visit the Standard newspaper, the publication of 2 days ago, and you can learn more about this topic. Thank you.